Hello, everyone. My name is Simran Chaudhary. I welcome you all on behalf of Voice of Healthcare to today's insightful session titled Golden Beginnings Prioritizing Nutrition and Breastfeeding in the First Hour of Life, organized by Voice of Healthcare and Neowinn Biotech. This conversation is part of our ongoing effort to spotlight crucial aspects of maternal and newborn care. And today, we focus on one of the most defining windows of opportunity, the first hour after birth, often referred to as the golden hour. This early period plays a vital role in shaping the lifelong health of a newborn through early skin to skin contact, immediate breastfeeding, and timely nutrition. It is not just a moment, it is a powerful foundation. And to help us explore this in depth, we are joined by the three esteemed experts from Cloudnine Group of Hospitals, each bringing a unique lens of experience to the table. And now I would like to introduce them. Dr. Chetna Jain, Director of the Department of Obstetrics and Gynecology at Cloudnine Hospital, Gurgaon. Welcome to our show, ma'am.
Thank you.
Thank you so much, ma'am. Dr. Prabhjot Kaur Dhillon, Pediatrician and Neonatologist at Cloudnine Hospital, Chandigarh. Welcome to our show, ma'am.
Thank you, Simran. Thank you for having me here.
Thank you so much for joining, ma'am. Miss Ruth Peterson, Manager and International Board Certified Lactation Consultant at Cloud9 Hospital, Bangalore. Welcome to our show, ma'am.
Thank you.
Thank you so much for joining, ma'am. And now, to dive into this conversation, I would like to ask my first question, Dr. Chetna. Ma'am, why is early nutrition crucial for both maternal recovery and neonatal health during the first hour after the birth?
So we all understand that golden hour is the most important hour. That means within first hour of delivery. So at the time, if we initiate breastfeeding, that means the baby is getting nutrition. Once the baby starts taking meal, so there's a lot of benefit. The colostrum will have high levels of immunity. That means antibodies, which will help baby develop gut immunity. The bonding is better. The suckling is better. The attachment, that means latching, is better. The baby's heart rate, the pulse, the breathing, everything settles very well. So it is very good for the baby to have golden hour breastfeeding. For the mother, the attachment, bonding, nipple, everything gets better. And also mother also needs to feed, and that is better once the mother had normal delivery. And that is why we as gynecologists or obstetricians always encourage normal delivery so that the women can actually feed themselves and feed their baby in a much, much better way. So it is very crucial to initiate feeding for the baby and, if possible, for the mother within the first hour of birth.
Thank you so much for answering that question, ma'am. And then we actually need to focus more on this important aspect because the education level and the awareness is not as much as we expect new mothers to have and to understand the benefits of it. I would like to ask my next question to Dr. Prabhjot. Ma'am, from a neonatologist perspective, what psychological benefits does early breastfeeding provide in the first hour?
So, Simran, as Chetna ma'am has very well narrated all the benefits for the baby as well as for the mother. So, psychologically, these babies, tiny babies, they are considered to be the most, the creatures who are very delicate, who are very insecure, to say it, in specific. So, it gives them the psychological security to be with the mother right after the birth. It's not just the moments of suckling on the breast which makes them secure. It is the moment when they are put on the mother's bare chest only. It starts from then only that they start behaving in a very secure manner, that okay, they are in the right place to grow. And that is how, and that is when their heart rate stabilizes. That is when their thermal regulation happens. And when they are in such secure space, so the cerebral circulation also is optimized, so it helps in optimization of their overall well-being. So it is really important, the touch of the mother, the suckling on the breast. So it is really psychologically important for the newborn baby.
Like you said, ma'am, it is very important that skin to skin contact on mother's bare chest. I think they connect with the same heartbeat they have heard the entire 9 months. I think that helps them to calm down and that have that connection again, right? And
True.
this makes them feel secure. So
Yes,
thank you
true.
so much for explaining that to us, ma'am. Uh, I would like to ask my next question to Miss Ruth. Ma'am, what are the most common challenges mother face when initiating breastfeeding in the first hour, and how do you address them?
Um, yes, Simran, and it's a great privilege for me to convey my message here, as both of them have conveyed beautiful information about importance of breastfeeding, early initiation. But then, having said that, how are we going to initiate the breastfeed when there is a challenges? So most of the time nowadays we find it very difficult. The mother who's going through most of them go through cesarean section. And as Dr. Chetan said, we all encourage as much as possible to do normal delivery so that the breastfeeding gets early initiation and mother cooperate along with us. So cesarean actually, more of cesarean, we find it very difficult to convince mothers to breastfeed, and as well as maternal complications that also give a distance in breastfeeding, and nipple issues, pain related, because post cesarean they go through a lot of pain, and then lack of knowledge. And these mothers are not attended any antenatal workshop, where they are not knowing anything about breastfeeding. They think after the delivery, put the baby at the breast, everything happens. No, it doesn't happen, because mother go through pain, lot of challenges, prolonged labor. We don't know, each woman go through different challenges to go through. The only obstetrician knows the challenges, how the woman gives a birth. So it's a real great war field. After that, the baby arrives, and with the so many challenges, so-called, which we are encouraging them to breastfeed, this is the challenges we face. And then this lack of knowledge is mainly all these issues to address. They all of them. Again, one more issue: early preterm deliveries, sick babies, they go to NICU. Again, mother and baby separation. These are the challenges. We are not able to initiate the breastfeed. So to address this issue, every woman who is pregnant, by second trimester itself, she should be encouraged to attend lactation counseling. Most of the time they believe, healthcare workers, it is lactation support or a counseling, it is not necessary during antenatal period. It is very important postnatal. No, it is only few obstetrician who's knows the science of breastfeeding. They make sure their mothers are attending the lactation workshop. So every woman has to attend by second trimester, so that if she delivers after 28 weeker, she knows how to express and maintain the supply, and she cooperate because she is aware of this importance of benefits of breastfeeding. So my thought in this: every woman has to undergo this antenatal workshop, which is mainly discussed about importance and benefits and management of lactation during separation of the mother and baby. Yes.
Very rightly said, ma'am, because I believe these counseling sessions, these education and awareness sessions, which are taught to, would be mother at an early stage, helps them to understand the complications and how they can take care of themselves and the newborn in a better way. I think, most importantly, if we educate a mother, she can take care of the child automatically or in a better way. And family support matters the most, and I believe nowadays there are spouses, families all ready to support the mothers. So I think that's the better change we are seeing here. uh, as we are focusing on how important is breastfeeding, I would like to ask Dr. Chetna, ma'am, what obstetric practices can enhance successful early breastfeeding?
So first of all, skin to skin contact and delayed cord clamping. So if we talk of delayed cord clamping, what we do is once the baby comes out and we see the baby is pink and crying, we would like to keep the baby below the perineum if it is a normal delivery, or at least at the level of wound scar in case of cesarean section. So we try to keep the baby below the level of the cord or the placenta so that a lot of blood from the mother to the baby is drained. So typically waiting time can vary between 1 to 3 minutes till the time we see the blood is still flowing and the placenta is not separated. So we continue giving this blood to the baby. This will not only enhance the baby's blood volume by 30%, it will also prevent anemia in the first 6 months of pregnancy. After that, the cord clamping is done. Then we put the baby on the mother's tummy, and it is so beautiful to see the baby crawling up towards the chest. You know, the newborn which has just been born, who doesn't know walking, talking, anything, and suddenly you realize the baby is crawling up towards the breast to reach the breast and to get their own meal. So this is it is God's blessing, or this is how it is designed, that even small baby can smell where the milk is, where the breast is, and they start crawling. So this crawl helps in attaining a better latching, better bonding, and better feeding. So all this. What Ms. said, obviously antenatal preparation is extremely important because are prepared from the very beginning, that you will need to feed the baby, that you will prepare the breast. So we examine the breast once they are 3 months pregnant and see if there is anything, any lump or inverted nipples, or if excessive dryness or fungal infection of the breast. So all that is prepared in advance, so that at the time of breeding, once the cord is clamped and the baby is cut, and if the baby is absolutely fine, baby can actually immediately put on the mother's tummy with a towel so that the baby doesn't get cold, and the pediatrician can rub it dry and the baby can start suckling. But most of the times what happens is the baby needs some attention, and then the pediatrician will make the baby try and just examine the baby and bring the baby to the mother, and that takes a couple of minutes only, doesn't take too much time. So golden hour breastfeeding is a reality, and we are proud to say that we are almost 100%.
Ma'am, you're not audible much.
Almost
Please.
100%, almost nearly 100% of the times, golden hour breastfeeding. So skin to skin contact and delayed cord clamping, this helps, and it goes a long way in attaining good breastfeeding. It also helps the mother, uterine contractions are better, the bleeding is less chances of postpartum hemorrhage, better bonding, better contact, better lactation and letdown reflex. So everything is better if we follow these two practices. That means skin to skin contact and delayed cord clamping. Thank you.
Ma'am, you just explained this process very beautifully to us, and it sounds so natural and so satisfactory and beautiful when you're trying to explain that. And I believe that process is so beautiful in itself. And thank you so much for all the healthcare professionals working there and all ready for the mother and for the baby. Uh, it's just the gratitude we can express to our healthcare professionals out there. Moving on to my next question to Dr. Prabhjot. Ma'am, how does colostrum specifically support a newborn's immune system and gut microbiome, since we're talking about this golden hour breastfeeding?
Yeah, that's a really good and important question, Simran. So, what happens is that the colostrum contains much of the immunoglobulins. This is, very rightly is known as the first vaccine of the baby, even before we give the baby the vaccine shots. So, it contains much of the immunoglobulins, which later on and in the immediate, neonatal period, they protect the baby from various infections. So apart from that, the microbiota, which the baby needs to have after the birth, it is provided from the mother's milk only. So it is commonly said that with that lining of the gut of the newborn baby, by that microbiota through the mother's milk, it helps to prevent the futuristic colic episodes. It helps to prevent the irritable bowel syndrome later on in the life. So these babies are considered to have less of the colics, and so less of the troubles to the neonatologist as well, while we would be seeing them in the OPDs. So formula fed versus the mother fed babies, you are going to have less of the troubles from the mothers. Yeah.
And I would like to add here, Dr. Prabhjot, especially in preterm, you guys are so keen because it will prevent
Yes.
necrotizing enterocolitis and also intraventricular hemorrhage. Sorry to interrupt, but yes, so you have covered it beautifully. But I thought these 2 points are also very
Yes,
relevant here with colostrum.
those are the perinatal immediate, neonatal period infections.
Yeah,
I didn't go into the technical terms, so
yeah,
thank you
yeah,
so much for
absolutely.
adding that. So all those are prevented. Yes.
Thank you so much, Dr. Chetna. Thank you so much, Dr. Prabhjot, for explaining us that process and the importance of cholesterol. As we are moving to my next question, to Ms. Ruth, ma'am, can you share some key latching positioning techniques that improves early feeding success?
Yeah. See, usually, no, when a normal delivery, it becomes very easy for us to make them sit and give them a cradle hold or a cross cradle hold or a football hold. When mother who undergo cesarean, they find it very difficult on a first 8 hours to sit and feed. Our logic doesn't work. So, however, we tell them, they say, no, 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 pain. I have undergone cesarean. I cannot sit. Or mother who had an extended episiotomy, she will not be able to sit and breastfeed. So, those cases, they can lie down whatever position they want. They wanted to lie down supine, or they wanted to do side lying or a recline, any angle they can breastfeed. If mother refuse, I cannot sit, we cannot say that, okay, you do tomorrow. And we tell them, no, you sit. Then they say they cannot sit, they insist for the other feed. So there are plenty of various techniques. I would recommend whether mother undergone normal delivery or a C-section. If mother is not able to sit and hold that traditional hold of cradle or a cross cradle, she should be encouraged and well supported with the sideline position. Or mother who has undergone cesarean, she can lie down supine, and the baby could be placed however it is. It's very important. Any position, we should be able to assist them. So, especially first day, it is very, very effective in latching is side lying. But only thing, all of them should be trained how to assist the mother by lying down position. And the disadvantages of lying down position is mother should not be left alone unattended, because she must be drowsy and tired and sleepy with the medications. So either the nurses has to stay, or the attenders, the caretakers, whoever is there, should be advised to be with the mother post feeding. They should take the baby and birth. So I would recommend the key latch on a first day is a side laying or a supine or recline. Yes.
Thank you for that answer, ma'am. And it is quite difficult for the new moms to, go through this process because this is quite new for them. They haven't experienced this, and the entire process of giving a birth is in itself a new journey, a very big process. So I think to understand and to relate, it's quite an overwhelming moment for them as well. So I believe that is quite difficult, and a few of the techniques which you mentioned will be helpful for them. And as we are with this session, we aim to educate new moms and their family as well, so that they can support in this journey to them. My next question is to Dr. Chetna. Ma'am, how can we better prepare expecting mothers, especially those at high risk for breastfeeding in the golden hours? Like you said, if like Dr. Ruth also mentioned in previous answer, that sometimes due to separation, mothers are not able to feed the baby at the right point of time when they are supposed to, because they are not together. So how can we train a new mothers in this case?
So, first of all, it is very important to put lactation in the birthing plan. That means from the very beginning and throughout the pregnancy, during this journey, they see the obstetrician, they see the neonatologist, they see the lactation specialist, put a plan. They should understand that it is a very important part of life. They can see the videos, prepare the breast, and make themselves ready. Now, majority of the women, we would say 80% are low risk pregnancies. So, as Ms. Ruth described, there should not be any problem in breastfeeding these women, especially if they are willing. All those who look a little unwilling because of various things, including, changes in breast shape or so on, or tiredness, or, my nanny can look after, I need to sleep and all that. So we prepare them emotionally, mentally. We tell them how to, take naps in between and how to feed your baby and optimize. And once they understand the benefits of breastfeeding for themselves and for the baby, they are actually happy doing it. So that is one. Now, for the high risk pregnancies, what happens is like 20% women might develop diabetes, hypertension, or similar. Now, these women, if we tell them that, if you breastfeed or so once the baby comes out and baby is in good health, we do not worry that the mother is having hypertension or diabetes. We actually try to put the baby on the breast immediately. Now, suppose the baby is sick, a very preterm, and the breastfeed is not allowed. Then also we encourage women to start doing expression of breast milk so that at the earliest opportunity that is possible on the post delivery day in the evening or next day morning, as soon as the pediatrician, the neonatologist, Dr. Prabhjot, will tell more to us on what all babies cannot suckle immediately. So we initiate lactation by expression of the milk through by hands or by pumping out so that the mother is ready. And as soon as the pediatricians allow, we send the mother to the nursery to touch the baby if skin to skin contact and a kangaroo care and that kind of thing. If the baby is not very, very sick, then it can be done. The mother can actually go to nursery NICU and breastfeed the baby if the pediatricians would allow. If not, at least, skin to skin contact and bonding can be initiated and pumping so that the mother gets ready as soon as the baby is permitted oral, intake. Then probably the first thing which needs to be given to the baby is colostrum if by the time it's there. Otherwise, the milk which is coming to the mother. So we try and express the milk if the baby is not consuming every 2 to 3 hours from breast on alternate breast so that it mimics very close to the natural lactation and the baby gets to feed. Yeah, these are some unfortunate events where immediate breastfeeding is possibly not possible, but still we try to reach as close to as faster and as soon as possible. At least we establish the lactation and see how soon the baby is allowed oral sips of breast milk. Yes.
Thank you, ma'am, for focusing and shedding light on that important aspect and what all cases that a baby cannot have mother's milk or in that unfortunate cases. Moving on to my next question, Dr. Prabhjot, ma'am, follow up on what Dr. Chetna said that you will be explaining us in what all cases or when does the pediatrician allow the baby to have the mother's milk, and on that, and which neonatal care protocols can hospital adopt to facilitate that immediate feeding in an intensive or transitional care settings?
Yeah, so really important again. Your questions are really important and insightful. So, as Chetna ma'am said, that generally the pediatricians and the obstetricians are on same page as far as the immediate breastfeeding is concerned, right after the baby is born. But there are certain conditions where we pediatricians or neonatologists, we are, not able to let the baby feed directly on the breast. So, generally, this is how we remember that there are two magic figures. One is a gestation of 33 weeks, and another is a birth weight of 1.8 kg. So, that cutoffs have been set. So, whenever a baby who is born at more than 33 weeks of gestation or the birth weight is more than 1.8, there is no issue in the baby's capability to suckle on the breast independently. So, they are definitely allowed. Yes, a baby who is, say, born at 33 plus 5 weeks of gestation but does not have stable breathing and does not have stable tone of the body to suckle. So first the pediatrician or the neonatologist would stabilize the baby. They'll take quickly 10-15 minutes to achieve that normalcy of normal breathing and normal tone. So after you have stabilized, you can put that baby on mother's breast if it is more than 33 weeks or 1.8 kg of weight. So by then we consider that yes, this baby has the capability to coordinate sucking, swallowing, as well as the breathing after you have stabilized. But sometimes these babies are stable enough. They do not require much of the respiratory support, but they are lesser than the 33 weeks of gestation at birth. So there, this coordination of these three processes, is really, really, not established. So in that case, first you stabilize the baby, then in place of direct suckling on the breast, you put the baby on the mother's chest so that the oxytocin starts producing. And once we demand, the expressed breast milk from the mother, there is no delay in the ejection of milk. So it helps in the early initiation of ejection of milk, even in extreme preterm babies. So after the neonatologist stabilizes such delicate babies, they should definitely be put on the mother's chest or the breast. Do not allow the direct suckling, because it will further decrease their weight gain and all, and it will further compromise their breathing. But yes, for the promotion of early ejection of milk, they should be put there. Number two, they would gain more thermostabilization by being there in the warm surroundings till the time the nursery people arrange the bed. They make all the arrangements for the further care of the baby, so the baby should get that safe environment there. So next part of the question I would want to answer is, what preparation a unit should make while you are going to deliver a baby who is not to be directly breastfed. So in that situation, the first the parents should be counseled that we would be doing certain physiotherapeutic exercises with your baby during your stay in the NICU. We would call in the mother, we would ask the mother to empty the breast so that the baby can suckle on the mother's empty breast, just to make the baby's oromusculature uh, capable of transitioning to breastfeed later part, during the later part of the stay into the NICU, while we would be discharging them. So the baby should go home by learning the breastfeeding skills in the NICU only. So, what are those oromotor motor stimulations? One we have just talked about is putting on the mother's empty breast, which is called non-nutritive sucking. The other one is the nurse or the mother can just clean their fingers. Usually, the little finger is used. They can stroke the lips of the baby gently, slowly. They can just massage their gums. One can allow the mothers to touch the palate of the baby, the middle part of the palate, so that the baby starts suckling on the on the clean finger, and develop those skills gradually to eventually start breastfeeding. So once they gain a required amount of weight, which is more than 1.8 kg, we can allow the full breast suckling during the later part of their stay. So this is what the team should be prepared for.
That's quite insightful, Dr. Prabhjot, and thank you so much for answering that question. Also, another question just in mind. I don't know whether this makes sense or not, but like Dr. Chetna also mentioned that in some cases, if mother has this hypertension or diabetes or something, if mother having this issues, can that be transferred to baby through milk when she has given birth, and that is at a higher level?
Absolutely not. we
So,
we allow
so
we
the
just want the mother to be in a good shape, to be in stable set of hemodynamic parameters she must be having. She should be able to walk to, or to be transported to the NICU. She should be given a comfortable chair to sit on, and she should be well hydrated. She can definitely feed baby without any danger of passing on those kind of
So,
situations to the
yeah.
baby.
So
Yeah.
mentioning that, unless the patient is on such severe hypertensive medicine that, she's taking injectables and she can't move. So that's a very different
Yeah.
story. When it comes
Yes,
to
that's a
diabetes,
different
in fact,
situation.
the mother's diabetes gets better if she suckles the baby, and the baby will also get to, because kya hota hai, after time of birth, the baby's blood sugar will drop because the cord is cut, and the high levels of blood sugars which were going to from the mother to the baby is suddenly cut. The baby is still producing insulin. The baby's blood sugars will drop. So in this scenario, if the baby gets mother's milk immediately, the baby will get the nutrition, will be able to maintain the blood sugars, and baby will not go into the levels of hypoglycemia, low blood sugars, wherein the baby will need IV drips. Similarly, for simple hypertension, the mother can be given overall injectable medicine, and once she's stabilized, she can definitely go there and feed the baby. And in fact, mothers will not have anxiety of separation from the baby, and the baby will also not have anxiety, and so the bonding will be better. In fact, the mother's blood pressure and sugars will also be better controlled. So it is recommended, that even if it is high risk,
You
as
should
far
do
as the
not.
mother is
Yeah.
stable, it can be done immediately, and it should be promoted, and it should always be encouraged. As she can be wheeled in if she cannot walk to the nursery, she can be wheeled in on a wheelchair, and obviously stretcher patients can't go, but wheelchair can go till the gate of the nursery, and then the patient can go in and sit on the chair and take the baby. So so many times when you go to nursery, our pediatricians like Dr. Prabhjot, you see they give small babies connected to all the you know uh, the monitors, and these babies are inside the mothers down onto the chairs, closed with closed button, and they look like the baby in kangaroo pouch. It looks so beautiful.
Yeah, yeah, sure, sure.
Thank you so much, Dr. Chetna and Dr. Prabhjot, for answering that question. So I just had that question in my mind. I don't know whether that was a relevant question or not. I'm sorry if
No,
that
that
was.
that was.
Thank you
It
so
was
much.
worthy, yes.
Thank you, ma'am. My next question is to Miss Ruth. Ma'am, how can nursing staff and family members best support mothers who experience anxiety or pain during the first hour feeding? Because they're also sometimes not ready for this process.
Yeah. See, most of our mothers after delivery, new mothers especially, they are more anxious. Whether am I able to produce enough milk, whether my milk is going to be sufficient, and from the surroundings they get the information pressing that only drops are coming, and then elderly people might say that when we press the milk ejects like that and you have only droplets and then your milk is not sufficient, they get discouraged how much ever we tell them. So this is the challenges mostly we face. They don't understand the colostrum comes in drops and it's a gold liquid. Gold comes in limit, and it's a high density milk. It provides all the nutrition and it protects the baby, which logic most of them they don't understand. So in case if they are able to attend the antenatal workshop, and they will come to know the benefits and the importance of breastfeed. Any mother, even drops is there not there, she is motivated to breastfeed. 80 percentage of mothers, they are able to cooperate in breastfeeding if they attend the workshop. That is, the research is proven. After the delivery, if they come with the pain, with the challenges, with the people discussing all advices, and they get discouraged, and then the nursing support from our end or a lactation counselors, anybody we discuss about this is enough, they say it is not enough. So the main thing is the nurses has to be taught and trained what is the intake of newborn on the first 2 days, and how to encourage mothers and counsel the mothers on the importance of breastfeeding. And especially we can't give the lectures post delivery, we can't talk about importance and the benefits, and
Yeah.
especially when there is a elderly people around, and we face a challenges like no grandparents or elderly people are there. No, we give honey, sugar water. Mother will not produce enough milk, and after third day only milk will come. So till such time we have to be supplementing. So it's a mix, and then it is transferred and it goes to the young woman who's a newly delivered. So these are the challenges we go through. So we that is the my main agenda to train the nurses. Today also when I trained, when I asked how much milk will come, 40 ml, 30 ml on a first day, it is not possible. 40 ml, 30 ml is only formula, and the breast milk. So when we are able to understand the concept, the 1 or 2 teaspoon is required once in 2 to 3 hours, and then the some babies after feeding they feed well at the breast, they transfer the milk effectively, and then the moment you wrap and keep the baby, the baby start crying. So the more number of time the baby cries and they keep bringing the baby to breast, and one fine day anybody says mother doesn't have enough milk or she's not producing adequate milk, give formula. This is the challenges the nurses at the bedside they face, and then they don't have any choice. They have to call the pediatrician. What pediatrician would tell, and the unnecessary the formulas comes into scene. So we have to educate the nurses. At the same time, the education should start as a partner in the antenatal period. So all put together, then we discuss certain things. Really, it helps in supporting. So it is the nurses who is constantly supporting them, continued support, encourage them, not to discourage with the size and shape of the nipple or size of the breast and no nipple, less nipple or small nipple. There are so many challenges when we discuss them, mother gets discouraged. So whatever situation, definitely mother breast can accommodate, mother nipple can accommodate baby's oral cavity. That's a God divine support to the baby and the mother. Only thing the different way of attachment. So everyone, the nurses should be taught how to support the mother and continue to support. And then the lactation counselors should be able to give the skill training for the mothers so that they are having a confidence. It is not just the mother job alone. She go through a lot of pain. And it is not that she has given a birth and she should be able to hold the baby and perfectly feed. No, she go through pain. So the family support is entirely very, very, it should be supportive. So especially than elderly people, mommy or mom-in-law, their ages are gone. They're 60 plus or 50 plus. They have their own aches and pains and problems. They won't be able to support. So the partner involvement should be very, very important. So they should be educated to be around the mother, give extra support for the household work, and giving a good atmosphere and restricting the too many relatives to visiting the mother on a first week. And these are the challenges. If family partner is able to take it, actually it's a wonderful journey after leaving the hospital, and the family can, the mother can continue breastfeed. And then one more thing I would tell all my nurses: support the mother continuously on a first day. Second day, mother should be able to sit and learn how to hold the baby, how to attach. If we keep pampering them every time, go and support and stand, until 3 days they avail this benefit. Then the third day they reach home, they don't know that, no clue only. They come back with the engagement and baby reducing weight and hyperbilirubinemia, readmission. So the baby go through pain, mother go through pain. It's a lot of challenges. So we should be able to encourage, especially I tell my pediatrician, you use your golden word to these mothers and the partner. One word you tell, remaining we will take care. You have to learn how to hold the baby. That's all you tell. No, pediatrician and the doctor's words are golden words for the parent because you have been handling. Especially obstetrician, they handle 9 months back to back. So they have a bond related with that family and the mother. So there, one word, you will learn, yeah, how to hold the baby. Don't depend on nurses 24 hours. If you tell one word, they most of the mothers they learn off. And the family also should be taught how to hold and position. These mothers will not come back to hospital either with the engagement or a blocked or painful breast, or the baby is coming to NICU for the readmission with the dehydration and hyperbilirubinemia. So that is where I would like to tell the mother should learn the support system is effective. And third day, 80% of positioning attachment, whether my baby is transferring milk effectively, it is not just the latch, it is not just the attachment, it is not just the position, whether milk is transferred effectively so that they come back with the problem. So these things should be addressed to the nurses and trained by the lactation counselors. So if the milk is not effectively transferred to baby, what is the next alternative till they come back and meet the pediatrician? So I would always ask the system or medical hospitals how the babies are advised to come back on a fourth day or a fifth day to meet the pediatrician, and seventh day, eighth day to meet the obstetrician. The mother also should be asked to meet the lactation counselor during that phase so that we know whether the baby is able to suckle, mother is able to position and attach. It is not just the attachment, sometimes it's a beyond the attachment. Beyond the attachment is the due to oral restriction of the baby. We keep start complaining of mother, you don't know how to hold the baby and attach. So many challenges they go through after they go home. That could be addressed if they come and meet pediatrician or obstetrician during that phase. We can avoid baby getting into unnecessary formula, and the first week the more formula, and then the supply comes down because the first week we all know it is an endocrine control, and the baby doesn't suckle much and not put into the breast, and obviously after a week or 10 days it goes into autocrine control. So it's a demand and supply, the supply reduced. Most of the women by then they realize their breast milk is reduced because of early formula. So if the effective milk transfer is addressed on a third day or a first week, the mother could be encouraged to express the milk frequently so that she can maintain the supply. So these education has to be transferred to family and the nursing, so that everybody, it's not a one man show, it is not from the mother end, it's a baby also is considered, it's an unspoken human. We should do the best, which Dr. Chetan and Dr. Prabhjot was speaking about beautiful about gut microbiome and the lining of the gut. It is so important to prevent later problems, chronic illness. This is all essential to address the issue on a first week so that the newborn journey goes very well. Mother doesn't get worried as the baby growing big, am I giving too much of formula, why I am not able to breastfeed. So these things has to be addressed and everybody should be able to support, so it goes hand in hand. The new mother enjoys, the baby unspoken human get the optimal nutrition from mother's milk. Yes, that's
Very rightly said, ma'am.
yeah.
And this shows the importance of how important is the antenatal counseling, the lactational counseling before the baby is born, after in the second trimester, and even after the baby is born, few days after it, they must visit the lactation expert so that they are well assured that the mother is doing right or wrong, or if there's some suggestions required, they can help them out. So thank you so much for beautifully explaining us to that. As we are coming end of our discussion, I would one by one ask my speakers to give us closing remark. Dr. Chetna, if you can just give us a closing remark for this session.
So I will tell all mothers, if you think that you can do it, then it is not impossible. Don't look at your age, the size of your breast, the nipples, what mother in law has to say. You believe that you will be able to do it. You work towards it throughout the pregnancy, intrapartum, postpartum, and you will achieve it. And you will be the happiest mother, because all those who are able to feed are very happy, satisfied, sleep better, and they have very good bonding with the babies. So believe in yourself and you will succeed. Thank you.
Thank you for that answer, ma'am. Dr. Prabhjot, your closing remark, please.
So my brief remarks while I visit, the ward rounds for the ward rounds. Whenever I, come across the parents of the, grandparents of the babies coming across as इनको तो दूध ही नहीं आ रहा है, बहुत कम आ रहा है. So I always say that, भगवान ने जिस मदर को बच्चा दिया है, तो उसको दूध भी दिया ही है. So one has to believe it, no second thought on that. And other things which we as physicians and pediatricians can help them out to boost their milk output is the hydration. So I again say that दूध पीने से दूध नहीं बनेगा, पानी पीने से दूध बनेगा. So they have to take more and more of healthy liquids whatsoever are available to them as per their cultural acceptances. So another thing is that. So third one is the nighttime sucklings. At nighttime, all the rishtedars and all they doze off. Everyone is so tired, but the mother has to, make sure that she, puts an alarm and she tries to let the baby suckle during the night as well, so that her brain gets to learn that yes, the demand is there, so I have to supply. So she has to train her brain even when she's not producing enough milk. So the fourth point, like Ma'am Ruth was saying, that the baby keeps on crying, asking for feed. It's not that always the baby needs to satiate their hunger. They just sometimes want to have the comfort feeding. They just want to suckle just for the comfort. So every time a baby is crying, you can allow them to put on the breast, but it's not that they are hungry always. They just have just one language to convey their demands. So the comfort sucking sometimes, is better to soothe their baby, and not to go into that loop that okay, milk kam aa raha hai इसीलिए ये बार बार रो रहा है. No, they find the mother's body to be a safe place for them. So they should be put onto the breast, they should be given KMC, and this is how we move forward.
Thank
Thank
you
you
so
so
much
much.
for that last tips, ma'am. Miss Ruth, your closing remarks, please.
So, the main which I have discussed, every woman has to, as a family, they have to undergo antenatal education, especially importance, and then maintenance of lactation and the benefits. That if they have attended, they are well prepared 80%. And then when they are admitted, when they are feeding, they should be able to learn as a family how to position, attach, whether the milk is transferred effectively. They should not come back with the weight loss and the dehydration or hypoglycemia. So they should, every mother should be able to ask the lactation counselor, though my baby is suckling, how do you think my baby is getting enough milk? This is common question, but they should be able to understand the milk transfer. There is a way of understanding that should be there any woman before going to home. And then the every woman, whether you are feeding well or not feeding well, painful feeding, comfortable feeding, they should be able to meet the lactation counselor when they come for a first visit to pediatrician. So that will make them more confident to go forward whether there is any challenges or they can continue with the breastfeed or something else, some other alternative support is required. It should be well informed. So all mothers, especially new mothers, should ask for a help and get it from the hospital as well as from the family. They are not running the race alone. They need help. Yes, that's my answer.
Very rightly said, ma'am. They're not running the race alone. It is a teamwork, and all the team of healthcare professionals and the family members are there to support them. But thank you so much, all the speakers, for sharing your views, insights, and expertise with us on this important, sensitive topic on the breastfeeding week, which is going on, the golden beginning, the golden hour for the mother and for the newborn. Thank you so much. This session has been quite and really insightful for us and for all the viewers out there. It means a lot that you are there with us to create this impact, to create education and awareness on this topic. Thank you so much.
Thank you. Bye.
Thank you. Thank you. Thank you, everyone. Yes.